Today, can you talk to us about how contract requirements possibly could impact our industry and impact locum tenens staffing? Anybody want to touch on that?
Yeah, and if you'd like to come to Denver, Colorado with the NALTO Fall Flight.
There's a whole panel discussion.
Yeah, there's a whole panel on this. I mean, that's probably a long-winded answer. You want to take? I don't want to dominate this part of the conversation.
Oh boy. So yes, there's a lot of implications based on what we're signing, what we're being asked to sign in contractual agreements. And we do have a whole session at the NALTO segment at the end of the month in Denver, Colorado. But we have a whole session on that because oftentimes, you know, some of the smaller locums companies, they want the business and they're signing the contracts and they're not understanding the implications not only to them, but the industry as a whole.
And by the way, some of these state laws that have gone through are actually retroactive. That's the frightening part.
Yeah.
So even if you have a contract that you signed 2 years ago, you know, again, and I'm, you know, there's several states, obviously Illinois, Iowa, Missouri has been named, but there are other bills that are making the way. Some have been defeated already, and this list we do have at NALTO, by the way, so if you'd like to see it, please feel free to reach out. Our concern is people will interpret these laws as saying that, well, according to this, you're a healthcare staffing agency, and we can move around and take your providers whenever we want. And that is not, that is in what will ultimately happen if that stands, and I don't believe it will. Just like, and I don't mind volunteering this information, so when AB5 happened and it was forced to employ NPs, PAs, and CRNAs essentially in California, my firm pulled out. Now, we aren't as large in the West as some other firms. Maybe it was easier for us to do that. But we would pull out of states that had that requirement. And who does that, again, it goes back, who does that hurt at the end of the day? It hurts the patients in the rural areas. It hurts us, sure. We have a business interest in mind, sure. It's okay to admit that. But the reality is that's not where the biggest impact is. It's the impact of the patients in the community as a whole.
Well, and I think you have to think about it, like most of those things start from a basis of there's some nurse, right now they're coming out of a wave of nursing discussions. And again, it's an unintended consequences. Yeah. Inadvertently, other clinicians get swept into contracting things that are not gonna help. And when we're talking about, you know, more jobs to fill in the marketplace of locums than we've ever seen in the industry's history, pulling out of one state, you can't fill the other 49 states. So for us, we have a pragmatic decision to have to make to shift where we fill, and that's not good for care in whatever state is in the implied issue seat there, right? So, and I think that's where contract terms are part of it, indemnity discussions are a part of it. And it's really, really important it's like people have to think the consequences of their actions down 5 or 6 steps, not just in the moment where nurse price gouging or whatever the topic that got us started.
Yeah, and you don't want to do it like an apple that you accept every time, you know what I mean? To your point, Liz, you just accept it, whatever it says on there.
Right. And in preparation for the upcoming session, we've worked on, what, about a 10-page document that's coming out with best practices and guidelines for signing contracts and all of the different verbiage and things to look at. And after the conference, it will be available on the NALTO website. Not that I'm trying to give it a plug, but I mean, I do think it's
the members only section.
Oh, members only section. But
no, it's a
fantastic
plug for
document.
Locumsmart. I mean, this is why, like, you know, being able to represent a vendor in a contract discussion in a way that represents all vendors, to make sure there isn't an inadvertent slip by a small vendor that sets us in an industry anti-competitive position. Like, that's super important. And I think, you know, we all have to know how important that is on the client's side of things as well.
Yeah.